Well, neuropathy is a disease that affects a large number of people in the United States. About 8% of people of the population has neuropathy. Of the diabetics, about 27% of people with diabetes know they have neuropathy. A lot more have neuropathy and don't know it. There's also idiopathic neuropathy, which means we don't know what causes it. And about 40% of all neuropathies are caused by either toxic chemotherapy, alcohol, heavy metals, Agent Orange, and things like that. So it's a huge problem. And up until right now, there has not been a way of treating it.
Are you finding more and more patients complaining of it?
Well, as people learn more and more about different diseases, including neuropathy on the internet, they're finding out there's something can be done about it, because most of the time their doctor says there's nothing we can do, but there is something we can do.
Yeah, let's talk a little bit about that, kind of the treatments and managing it.
Well, the patient goes through a thorough evaluation. We are, of course, not a medical clinic, but for example, if they have diabetes, we make sure that their diabetes is under control. The hemoglobin A1C, for those of you who have diabetes, probably know what that is. We then do a nerve test, which is a very sensitive test for small fibers, small nerve fibers. I actually helped develop in the middle 90s, and this will tell us, it's very sensitive, will tell us if people have neuropathy. If they don't, we would figure out some of the source of the pain, like coming from the back. I'm an interventionist, so we can figure that out. But then what we go ahead and do is start treating it with a series of injections, local anesthetic given Monday and Friday, a small dose, only about a fourth of a surgical dose. Then we follow on with a very, very far advanced electromedical device made by Synexus Corporation that is utilized in conjunction with the block to start the body healing. The healing is affected because it increases blood flow, it increases inside the cell something called cyclic AMP, which I don't mean to be technical, but this is associated with cell healing. We let the body do what it can do, we let it heal. We're treating a chronic disease with acute means. The other thing it does is it boosts the immune system. I use the machine when I do when I do back blocks. I don't use steroids. I use the machine, which the steroids will suppress the immune system. The electromedical device, the frequencies increase it, and we can program the machine according to what the patient has. This is a long treatment. It's 2.5 months. We're not like a medical destination, because people have to be treated 3 times a week for 4 weeks, then we reevaluate, then we continue. The reason is because it's a chronic disease. People have had this for years, and we're changing it. But the body takes time to heal. As you know, a fracture takes 6 to 8 weeks, and this is the same thing.